Hello everyone, my name is Kelly Cunningham and I did my practicum with the Nova Scotia Health Authority, and my project is on knowledge transfer recommendations for Lyme disease in Western Nova Scotia. So first off, what even is Lyme disease? So Lyme disease is from black-legged ticks, which is also known as deer ticks, that carry a bacteria called Borrelia burgdorferi. Now, only black-legged ticks carry this disease that causes Lyme disease. However, not all black-legged ticks are in fact carriers. So as you can see from the photo on the screen, how tiny these ticks actually are, that how they increase in their size once they engorge with blood, and that both young and adult ticks can in fact carry Lyme disease. Lyme disease in Nova Scotia is an emerging problem. Nova Scotia has a suitable climate for tick growth and reproduction, which is causing an increase in the tick population. Ticks are most active during the warmer months, which for Nova Scotia is April to September, if we're lucky. And as you can see, in 2016, we had 332 cases, which is the largest amount thus far in the province. The Nova Scotia Health Authority has 4 zones: Western, Northern, Eastern, and Central. My project focused specifically on the Western zone, which is shown in the yellow on the map, because 83% of the Lyme disease cases were in the Western zone in 2016. So this was a total of 277 probable and confirmed cases. The purpose of my project was to best understand how we can provide information and education about Lyme disease to specific targeted groups. From that, I was able to make suggestions and recommendations of the best approaches for knowledge transfer when providing information to these targeted groups. So, my targeted groups in the Western Zone were schools, recreation departments, and the Ketchimakujik National Park and National Historic Site. So for public schools, I looked at their 2016-17 student enrollment number for each school. For recreation departments, I looked at their number of children and youth ages 0 to 18 who participated in their 2016 summer programs, and also their most common age. And for KEJI, I looked at their visitors' residential geographical area and group composition for the 2016 summer season. So first off, why summer? So as I mentioned, majority of the Lyme disease cases in Nova Scotia occurred during the summer. And why these targeted groups? So for school boards, students go outdoors in near wooded areas before and after school, during recess, and during lunch break. Students are also in school during 4 months that are considered high risk for tick occurrence: April, May, June, and September. For recreation departments, summer programs typically have outdoor activities, and for KEJI, it is a common summer destination for visitors of all ages and geographical locations. My findings for school boards was that 30% of schools in the Western Zone are located in high-risk areas, and it is unknown whether these schools actually know that they are in fact in a high-risk area. So in total, this is close to about 9,000 students who are at a greater risk. And 63% of these high-risk schools include elementary-age children, which can be as young as 4 years old. My findings for recreation departments. So the Western Zone has 19 departments who provide summer recreation programs to a total of almost 9,200 youth and children. And the average age is about 5 to 10 years old. It has also been found that past distribution of information has not adequately reached all of these departments. My findings for KEJI was that in their 2016 summer season, they had approximately 36,000 visitors. Over 88 were paid visitors that were used for analysis, and with valid records of their origin, so their country, their province or state, and their postal codes or zip codes. The group composition, there was 74% of adults and seniors only, and 27% included groups with children. Also, these numbers do not add up to 100% due to the roundings from Parks Canada. For the visitors' origin, 80% of the visitors originated from Canada, with 89% of those visitors from Nova Scotia. From that, of the top 3 Nova Scotia municipalities, there are 2 that are located in the Western Zone: Lunenburg and Kings County. So after all of that, I was able to make some recommendations. First, for the schools. it is recommended to inform schools who are located in high-risk area that they are in fact in a high-risk area. So this will bring greater awareness to increase prevention measures within the actual school day. The Nova Scotia Health Authority can provide sample information sheets or paragraphs to send to parents, guardians, newsletters, or put on their websites during the months of high tick occurrence. So this can explain the what, where, when, how, etc. So in my project, I actually did include a sample letter that they can send out. For recreation departments, so most recreation departments hire summer students to implement their spring and summer programs, which is during the prime months for tick occurrence. So I personally have been working for the past 7 summers with the recreation department in the Western Zone, and I have not heard a single thing about Lyme disease or tick occurrence. So this shows a need for this targeted group to definitely be improved upon. So my recommendations is to direct information to these summer staff. So they need to be mindful of the timing. So typically summer staff begin at the beginning of May. Emails should be requested to be forwarded to summer managers and coordinators and to include some sort of Lyme disease information in their summer staff training. As well, the Nova Scotia Health Authority can provide a webinar, which is a one-time opportunity for summer staff, particularly the management or office staff, to actively take part in learning about Lyme disease. The ideal time for this is between the middle of May and the middle of June. As well, the Nova Scotia Health Authority can provide information sheets for parents at the beginning of programs, and it is recommended that they have on-site insect repellent with DEET or Icardian. My recommendations for Keji is to put a sign in their free community showers as a reminder for the public to check for any ticks or unfamiliar black dots. We can partner with the Campground Hosts to provide personalized information, and they can put signs in or near high-risk areas, such as their Keji seaside, rental locations, hiking trail entrances, information centers, etc. As well, at their information desks and local shops, they can encourage purchasing insect repellent with DEET or Icardian. So the Nova Scotia Health Authority is new in the province. The Western Zone used to consist of 3 different districts. So it is recommended to update the former health district websites because currently 1 out of the 3 Western previous district websites have any sort of Lyme disease information available. So if these websites remain publicly available, it is highly suggested to provide a link where to look for Lyme disease information or redirect the public to the Nova Scotia Health Authority website. As well, it is important to consider social marketing and the basic elements for communication, their targeted audience, assess the method's effectiveness, and redefine the materials for future use. Recommendations to continue or commence the season is their message placement, such as hospitals or waiting rooms, social media, and newspaper columns. So in conclusion, it is important to consider the target audience, so schools in high-risk areas, summer recreation employees, and provide greater opportunities for Keji visitors to be informed, because ultimately we want all people to enjoy the great outdoors safely. So I would like to acknowledge my supervisors, Kim Benjamin and Kim McGill, Linda Earle, who is the Medical Officer of Health in the Western Zone, the Nova Scotia Health Authority public health employees, Kathy and Lynn, who were both my readers, and as well as Sari, who was very supportive as well. So I thank you, and do you have any questions?
Yes, questions. Excellent.
I'm curious for people who do find a tick, like what is the best practice?
Perfect. I'm glad you asked this question. So the most important thing I learned during my practicum is if you find a tick, you have 24 to 36 hours to get the tick off of you before you get Lyme disease. So this is so important because if you check yourself regularly and you see a tick, you have to take it off. Now, in order to take it off properly, you have to take it off by the head. I'm very passionate. I don't know if you can tell. So you need to pull from the head because if you pull from the body, the tick is going to bite you and then there's a higher probability of getting Lyme disease. So yes, pull from the head.
Other questions?
I just have a really quick question, and it's with regards to short-term treatment. I understand you can have medication within 30 days and be quote-unquote cured from Lyme disease, but then after the 30-day mark, they seem to have trouble recognizing and diagnosing chronic Lyme disease in Canada. So I was just curious your thoughts on that.
So Lyme disease is becoming more researched every day because it is becoming more of a problem, not just in Nova Scotia, but in Canada and different states. So my project specifically didn't focus on the treatment of it. However, there is a lot of research that is being done.
Could I chime in?
I would love for you to chime in, Lynn.
So I have Lyme disease, and I also have Babesia, which is one of the common co-infections. And I got mine in Michigan, which is a very lovely tick-laden forest. I had a very hard time getting diagnosed because here in British Columbia, it's not recognized as something. And my family physician, who was a lovely young man about a year out of medical school, when I asked him to be tested for Lyme, he said, well, personally, I don't really believe in Lyme. So I ended up finding a good naturopath, and it's taken me, I'm in my 4th year now, I think, and I'm finally better, but it's a brutal, long haul. And my naturopath has treated other folks who were treated within the first 30 days, and it seems to be out of their body. So yes, look at yourself, even the parts of yourself that you think you shouldn't look at regularly. Any other questions for Kelly? Yeah, just a second. I'll be right over.
Thanks. I don't think I need the mic, but use it anyway. I was quite surprised at the number of cases in the last year. Was it 323, I think?
332.
Oh, okay. So I'm really curious because a lot of your recommendations around education were targeting children, and I'm just wondering about demographics of those cases and how many were actually children and how many adults.
Yeah.
How does that demographic switch?
Yeah, so the statistics that we get from the Nova Scotia Health Authority does not separate them in age. So it's just a lump sum of when people get them, the month, and that type of thing. So the reason we focused on kids is because typically when we provide information to children and youth, it will reach a greater population. So it will reach the parents, the guardians, and hopefully it'll provide more information for everyone in the community.
Okay. I think that's about all the time we have. Thank you so much, Kelly.
Thank you.